Hi, this is Dr. Darwin, the new dentist coach, with another edition of Ask Dr. Darwin. When you ask questions about getting into dental school, getting into residency, becoming a dentist here in the U.S., whether you're an international dentist, which has been a very, very popular request recently, you ask those questions and we get those questions answered to you. If you guys have questions, be sure to send them to me right here at newdentistcoach@gmail.com. newdentistcoach@gmail.com. Today, what you're going to be learning about is getting into dental school and some tips for those of you that may have a low GPA or maybe even have maybe a low DAT score. What are some of the things that you can look into that may help you, that will help you boost your candidacy into getting into dental school? So today we're joined with a pre-dental who's looking into the profession of dentistry, and we're so happy that he's considering it, and we're going to help him along the way. I want to introduce future student Dr. Rontae Graham. How's that sound? That sound good, right?
Sound real good.
It does, man. We have a slight delay, but we'll work through it. So introduce yourself to everybody. Tell us a little bit about yourself, where you're from, and why dentistry.
All right. My name is Rontae Graham. Arkansas. I'm from Arkansas.
Where are you from?
I'm from Hot Springs, Arkansas.
Arkansas, okay.
And I want to go into dentistry because whenever I had my first experience, bad, but it actually was the total opposite. And so as I was growing up, I always in my mind, and then whenever I got into high school, I actually got the chance to shadow at a and it was one of the best experiences that I ever had.
Gotcha. So tell us a little bit about your undergrad studies as of right now.
I attend the University of Central Arkansas. And I'm a senior biology major.
Nice. Second year bio. Ooh, that sounds like a whole bunch of fun. Whole bunch of fun. So share with us your question. What question you have for Dr. Darwin today, man? What's your question, your concern, your problem, your issue?
Okay. So my question is, I have a low GPA and an okay DAT.
You have what? You said a low
GPA.
Low GPA.
And an okay DAT score. And so I just want to know, what do I need to do to and if I don't get in,
I'm gonna have you bring your phone up a little bit. You said what you need to do what?
To get accepted. And if I don't get in this year, what do I need? What are the necessary steps I need to take after graduation?
Oh, okay. So what do you do to get accepted? And if not getting accepted at the first go around, what are the necessary steps after graduation to get accepted? That sound about right?
Yes, sir.
Okay.
Yes, sir.
So what year are you? You said what year are you at Central Arkansas?
I'm a senior.
Senior. Okay, not second year, but a senior. Okay. So look, man. Here's the deal. We're just gonna cut right to it. What's your GPA and what's your DAT?
My GPA is a 2.9.
My GPA is a 2.9.
And my DAT is a 17.
And my DAT is a 17.
17. Okay. So you already know that those are two very important factors of getting into dental school. You already know that. I see you shaking your head like, yep. So you know that. So you're on your way, but you got some way to go.
Right.
All right. So, I would say more so your DAT score right now, because there's not too much you can do as a senior to really change that GPA. I mean, you got one more semester or 2 more semesters left. Unless they were, heavily weighted classes with a lot of credit hours and you got an A, I don't see you really pushing up that 2.9 to like a 3.5 or something like that, which is kind of puts you in the realm of being competitive. So that's the first thing. So GPA, we really can't do much about right now if you are applying to dental school right now. But what you can control is that DAT, man. How many times have you taken the DAT?
I've only taken it once.
Once. Okay. And how did you prepare for the DAT?
I use DAT Bootcamp. And DAT Destroyer.
Okay, so Bootcamp and Destroyer. And when you went in and did your exam, how did you feel coming out of it? Like, what was your gut feeling after taking the exam for the first time?
It was very overwhelming.
Mm-hmm.
But I knew that I can. I know I can do.
I
I had only studied for a month because I was taking
classes.
So you said you only studied for a month?
Yeah, I was taking summer classes at the same time.
Okay. So that may explain why it was so overwhelming, because it sounds like you may not have been as prepared as you probably could be or could have been.
Right.
Most schools that you're going to be applying to, and we can talk a little bit more later about in those schools, but most schools that you're going to be applying to, they want an academic average of at least 20 and above, maybe even 21 on some of the more competitive schools. So if your score was a 17, and was that your academic average or overall average?
Yes, it was.
Okay, so we've got 3 to 4 points we've got to increase ASAP, right? And we don't have a lot of time, because if you're applying now, what some schools may say is, well, some programs you may get an interview, but maybe not as many as you could get if you had a higher DAT score, which means that you have to take the DAT like now so that you can have the scores ready within, I think they usually come out in anywhere from 2 to 6 weeks, so that you have those scores so that you can go and actually be considered for interviews, because they're going to want to see that that DAT score prior to your interviews, and that's what's actually going to help you get an interview at this point.
Right.
Now maybe if you had a 3.5 and a 17, you may get some interviews depending on the other parts of your application because of your GPA. But I'm thinking that because your GPA is a little bit lower, that may not be the case. So right now, the main thing you've got to focus on, man, is that DAT. Are you planning on taking it again?
Yes, I do plan on taking it. I just don't know when I'm going to take it.
Okay, so that's that's what we got to work on, because if you don't know when you're going to take it, you may be missing this cycle of dental school, this application cycle, because it's almost November now. You got 2 weeks before it's November, and guess what? They have started interviewing already. So if you haven't taken it, if you're not scheduled to take the DAT by the end of this month, it may take another 2 to 4 weeks before you even get your score. That means we're going into mid to late November, and there's some early decision. I think they have some early decisions for some of those schools where they make acceptances as early as December, and then they have another round that goes later on, early spring, February and March. So if you don't know when you're taking that exam again, then we've got to backtrack and figure out now what's making you what's unknown about when you're going to take it again. Why is it unknown? Is it unknown because of your current course load, finding time to study? What do you think?
Probably finding time to study for it.
Probably finding time to study for it.
Mm-hmm.
Because the next time I take it, I want to give myself.
The next time I take it, I want to give myself.
You want to give yourself what?
2 to 3 months to study for it.
2 to 3 months to study for it.
Okay. How close are you finishing your biology major?
I graduated in May.
All right, so you graduate in May, and you're on track with that graduation time frame?
Yes, sir.
Yes, sir.
Okay. Well, if you're on track, that means you're still studying for your major and to graduate. So that, I think that's where the competition, that's your competition right now, your time. And no one knows better than you as to how you're going to be able to carve out time, especially if you want 2 or 3 months of study time. So even if that's the case, if you want another 2 to 3 months of study time, and right now it's October, guess what? That means December. That means you've got to stop everything that you're doing right now, study for the DAT from now until mid-December, and take it in late December. And I don't think that's possible. It doesn't sound like that may be a possibility, right?
Right.
Right.
So and we're just keeping it real, which is going to be helpful, which means that you may have to go through another cycle of applying to dental school, meaning you may not be applying for the entering class of 1920. You may have to do another cycle, wait another cycle for the class of starting in 2021, that first year, which is fine for some people in some majors, in some situations. People will take what we call a gap year, or even consider doing a postback. And I think you mentioned that before online via email that you've considered maybe looking into some master's program where you do a postback. Is that correct?
That's correct.
So actually, those are the 2 biggest tips I have for you, strategy-wise, for you, man. Because it doesn't seem right now, time-wise, that you're going to be able to really concentrate on studying for the DAT, which for you is going to be very, very crucial. You need to have a 2021 to be in the conversations to be considered for an interview. That's just my opinion. I mean, you can check with, if you have some other colleagues or other people that you may know, or I can put you in contact with some current first-year dental students or second-year dental students, and they'll tell you as well as far as maybe what their DAT score was in combination with their GPA, and what their experience has been during the time that they've done their same interview cycle. But I'm rest assured, I'm thinking most of them will tell you that they either had to get their GPA up and do a postback program, and or they had to get a better score on their DAT. So like I said, for you, you know, you're completely downhill with raising your GPA as an undergraduate. But that's one of the advantages of doing a post-bac program, is that you can consider doing a post-bac program, and which will help you boost your GPA, but you've got to be spot on all of those science courses that you're taking. All right, they're going to be at a slightly higher level than what you're taking now in undergrad, but the advantage of doing the post-bac is that it can help you not only be prepared for some of the information that you're going to be studying for the DAT, right? But also it's going to get you prepared to have possibly have a higher GPA that you can use as part of your candidacy. That makes sense?
Yes, it makes sense.
Yes, it makes sense.
So, you know, I wouldn't want you to be fighting yourself and trying to study for the DAT, but at the same time, maybe have that time being compromised to you finishing your degree in May, because we want you to walk across the stage, get that paper, and keep it moving, right?
Right.
Right.
That's right. That's right. So, you know, it may be worth considering putting off, kind of postponing applying to dental school for a year so that you have more structured, meaningful time to study for the DAT. That's my opinion. That's my tip for you, my strategy. That's the best way I can answer your question about how to handle your low GPA and your DAT score. Now, also with your DAT score, another tip that you'll have, and you know, let's stay in touch between now and after graduation. But another thing that you're going to have to do with that DAT, man, is you have to practice more and more tests. You have to do more tests to be familiar with the how the questions are being asked, the selections that they're giving you as far as being able to weed them out, but also understand what the question is really asking. And that only comes through repetition, doing it over and over and over and over. And then also, you know, being a master of the information that's part of your major as a biology major as well. So those two things between now and the next year and a half, I think those are the things you really got to concentrate on. Because I think right now you may be putting yourself through some additional stress and time to try to find time to study for this DAT. Mm-hmm. I mean, your time is out. Mm-hmm. Your time is really out. If you're looking to have 2 to 3 months of really good study time, that puts you at the end of December trying to take this exam. And by that time, most schools have pretty much gone through their candidates and offered candidates for interviews. There are some schools, you know, in January and February, they may be doing some more interviews, but you know, right. I mean, if you're really passionate, right, and you must start dental school, you know, 2019, then I would say go for it. But just keep in mind, you don't want to waste your time and the money, right? The investment that you put into studying, using those prep courses, and also applying to take the exam, that costs money, right? Money equates to time. Time is money. So you want to really make sure that you're putting your best foot forward in applying. And part of that putting your best foot forward is you carving out the necessary time that you need. You may be better served after graduation in May, going back and spending the summer, take a couple weeks off, spend the summer, 2 or 3 months studying, and then taking the DAT late summer and see how you do. That way you give yourself some more time.
Okay.
And it's Concentrate it, and it allows you to concentrate your time more on one item versus you trying to graduate one item and you take the DAT and study for that 2 items. It's a lot. It's a lot going on right now. I can imagine. I remember.
Yeah.
Yeah.
Right? So, only way that you can control that level of being overwhelmed is that you've got to control your study environment, and you've got to control how you study and the quality of your studying time. Only having less than 1 month while you're taking summer classes to graduate, it's not enough hours in the day, Doc. Not enough hours in the day. Right?
Right.
So that's what I would, that's my answer for you, man. Is that helpful?
Yes, that was very helpful.
Yes, that was very helpful.
Okay. Because, you know, you got to keep in mind too, in order to get in dental school, you also got to graduate. There's not too many programs that are taking PreDentals out of college into dental school without having that degree. So I would say step 1 is focusing on that. Step 2 is reallocating your time after graduation directly for studying that DAT. You already are on, dental boot camp and dental destroyer, which is great. And just doing more exams, and then, maybe mid to late summer, take the DAT again. And I would say maybe consider applying for the cycle for 1920 instead of this one, 1819.
Okay, that sounds like a plan.
Yeah. And that, what you'll do again, man, you'll relieve a lot of stress off yourself immediately.
Okay.
But once graduation hits, you got to hit it hard, because you only have 3 months where you can actually get some good studying done and start this whole process all over again. But you'll have some better time. You have more time to do it. So that's what I would recommend, man. And I hope that's those tips and strategies are helpful for you in your particular situation.
That sounds good.
Okay.
Thank you.
You're welcome, man. You're welcome. And if you guys are listening, hopefully you guys will say thank you too. But you have to send me a question. If you have a question that you want us to answer, or you have a particular situation, something that you're fearful of, that's causing you some stress, some anxiety about, shoot me an email right here, newdentistcoach@gmail.com. newdentistcoach@gmail.com. Future student Dr. Graham, hey man, thanks so much for reaching out to me. I appreciate it. I would tell you, if you have any other questions, just stay in contact with me. You got my email address, and good luck with this semester, and let's stay in touch, okay?
Okay, sounds like a plan.
Sounds good, man. All right, and you guys check out the next video right over here, and that'll be a good resource for you too. We'll see you next time. Bye.